Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department, and I want to welcome you to the Memphis-Shelby County Joint Task Force update. Today I'm going to give data updates as we always do, and Dr. Randolph has joined me today, and he's going to talk more specifically about sports, and then we'll open it up to Q&A. We continue to have good news in that our overall average new cases per day is now running below 200 per day, which is positive, and we had an increase of 157 cases over a 24-hour period with a total of 25,664 cases. Unfortunately, we've had 340 deaths, but that does continue to keep us at a very low death rate of 1.3%, which continues to bode well for Shelby County. Any death is a death that we want to avoid, but we have had significantly less deaths than some other communities have. We've had over 85% of our cases recovered, and recovery, again, is anyone who 21 days after diagnosis is doing well and has not succumbed to the illness. And then we have had 13% of the cases that are what we call actively open, so they're in that 21-day period, which is a little bit over 3,000. We still are having about a 10.8 positivity rate overall for the pandemic, but over the last several weeks, as our positivity rate has continued to decline, we're running at 13% or lower. We want to continue to get that down to at least 10%, but then over time we want to strive to reach a 5% or less positivity rate. That means that we would have less community transmission than we were having previously, which is important, particularly as we get back to school. I want to end on contact investigations and then give some updates on some of the newer guidance around contact investigations. I've shared this previously, but it's worth noting again because this is information that's evolving daily. Currently, we have been able to close 64% of our contact investigations, and what that means is those are cases that are completely closed and the file is put up. We oftentimes will have a significant number of open cases, and that's because of the volume of cases that came in July and then the ones that continue to come in August. And as of today, we have identified almost 24,000 contacts, and currently we have 9,763 people under quarantine. So just as a reminder, isolation applies to individuals who have been diagnosed with COVID, and individuals have to be isolated. That means away from everybody else for a minimum of 10 days, and they have to be symptom-free for 24 hours. That is a change that's just come into effect in the last week or so. So 10 days and 24 hours symptom-free. But if someone is symptomatic, they may have to be isolated for well over 20 days. And it's just important to note that because it does have a significant impact on one's ability to work, go to school, and so on, which is another reason we want to reduce transmission, particularly as we are more in what I have called marathon mode and a focus on living with COVID and reducing the impact in our community. So we want to reduce the impact on people's ability to work and children's ability to go to school. For those who are contacts, and that's individuals who have been in close contact with a known case while that case was infectious, have to be quarantined for a minimum of 14 days. If it is a household contact, the 14 days does not begin until the 10th day of the case's infectious period. What that ultimately means, and this is particularly germane to students, because they may actually have been exposed in a household, that a child who is a contact could actually miss up to 24 days of school because they have been a contact. So we want to make sure we're getting back to business, we're getting back to work, we're getting back to school, and we want to continue to strive to reduce transmission in our community. So we really applaud everyone in Shelby County who has taken the steps necessary to reduce transmission. We know this has impacted businesses, it's impacted our ability to be social, and quite a significant number of areas have been impacted. But we really implore you to stay the course, continue to wear your mask, continue hand washing on a regular basis, continue to make good decisions about where you travel, when you choose to go out, what events you choose to go to, and if you have any symptoms whatsoever, get tested. And with that, I'm going to turn it over to Dr. Randolph. He's going to talk about sports and perhaps some other things around our health directive, and then we'll open it up to questions. Thank you.
Thank you, Dr. Haushalter. Good afternoon, fellow citizens of Shelby County. Dr. Bruce Randolph, the health officer. Just want to spend a few moments discussing sports. As you well know, it's getting that time of the year. Many high schools preparing for their first game. Colleges, those who have decided to play, are also practicing. As I mentioned before, and you may already know, is that Governor Lee issued an executive order 55 that allowed for contact sports to occur. As stated previously, the health department's position is that we still feel that contact sports is something that we cannot recommend. At this time, we feel that it's not safe. However, it is a decision that schools, non-school supported sponsors and organizations would have to make in terms of playing. Certainly it's a decision that parents would make in terms of deciding whether or not their children will participate in contact sports. Our role is primarily to provide guidance and technical assistance. Now, one thing that the health department does have a role in is determining the spectators and the fans that's in the crowd. We have guidance whereby we have limited the number of people who can be at a sporting event. It's primarily based on 12 feet separation as well as wearing of the mask. If you read the health directive, it states that for outdoor sporting events, there's a 12 feet separation requirement. Indoor sporting activities currently is 18 feet separation. We're revisiting that based on changes in our data. Of course, every 2 weeks we look at the data and reissue health directives. And so the health directive number 11 should be coming out shortly next week at the latest, pretty much corresponding to what the data has dictated to us as the changes that should occur. With that, I will stop and we will entertain any specific questions that you may have at this time.
Laura Testino, Commercial Appeal.
Hi. So wanted to ask about school reporting. Initially, the health departments both here at the state did not release case information for nursing homes, then eventually changed course. There are, of course, students and staffers with underlying health conditions at schools. Why won't the health department report this information publicly?
So at the current time, we will follow the guidance of the state, which is to do what we would normally do in the event of a case in a school, which would be to work with the school system to identify everyone who is a close contact, those who are at risk, and communicate directly with those individuals who are at risk. And that's the highest priority, and that's where we'll focus our communication. Over time, if there is a situation or an incident where there are a significant number of cases and that poses a risk to the general public, we can make a decision to make that information known at that particular time. What I know currently is that the Tennessee Department of Education website will have some information that's available to the public. It's more around facilities, not the number of cases, but it does give information on restrictions within facilities. And then also the Tennessee Department of Health will start to identify those number of children between 5 and 18 who have tested positive in a community. We will also share that particular information locally. And you follow up?
Sure. I do understand that schools have been advised to do their own contact tracing.
That is not correct. So go ahead and finish your question, and then I'll clarify what they've been asked to do.
Sure. Yeah. It would just be, that was what I was under the impression of. And so, I understand that it's the health department's responsibility to notify if there is a large outbreak at a school, but was going to ask, without doing the contact tracing, how you would know about those outbreaks to report.
So great question, and that is a misperception of the public and perhaps even some others within schools or other areas. Contact tracing and case investigation is the sole purview of public health in local health departments. So we have a statutory responsibility to do the case investigation and the contact investigation component, which is the tracing and notification component. By law, only the health department, and specifically the health officer or any of his designees or her designees, can issue an isolation or quarantine order. What we are doing with schools, and we have done this historically with businesses way before COVID, is that we rely heavily on the organization, in this case schools, to help us identify who may have been exposed. But that is not a contact investigation. That's identifying who within a classroom was in close proximity, which teachers may have been in close proximity, but ultimately it's the health department that identifies those contacts, does the contact tracing, and does the notification. So I appreciate the question so that we could clarify for the public.
Greg Hurst, WREG.
Thank you very much. I appreciate it. Dr. Haushalter, I'm hearing that flu shots are already available at doctors' offices and some pharmacies out there. What is the health department's recommendation on getting flu shots in the age of COVID-19? Is it too soon to get vaccinated now? Is there any concern about getting it now? And will that conflict in any way with any future coronavirus vaccine?
Really great question, and we're focused heavily in public health around flu vaccine and getting prepared for a COVID vaccine. Once flu vaccine hits the market, and that's generally the end of August, now early September, we encourage people to go ahead and get vaccinated. We do know that it takes about 2 weeks to build immunity. We also know that generally in this area we don't begin to have circulating flu until later in the fall, particularly November, December, January, and then sort of trailing off into the late spring or early spring months. What I would note is that it's never too early. If it's a person is at the physician's office or provider's office and flu vaccine is available, go ahead and get the vaccine. If you happen to be in a pharmacy that has vaccine available, please go ahead and get your vaccine. It's really critical that we get our vaccination rates up locally. We really don't know at this point how the intersection of flu and COVID is going to work, but we do know that if people get flu and COVID, the likelihood that they're going to be ill is much higher than if they had one of those individually. So again, I'll be standing on my soapbox here. Please get your vaccine and get it as soon as it's available.
Dr. Haushalter, thank you. Also, are younger people still driving the infection rate for COVID in Shelby County?
Yes, the majority of our cases are really between the ages of 18 and 45. Those individuals are less likely to be extremely ill, but as we know, they are able to then spread it to our more at-risk populations, particularly those over 55. At this point, approximately 55% of our cases are between 18 and 45.
Kendall Downing, WMC.
Hey everyone, good afternoon. I have two questions. The first question has to do with athletic events, as you all mentioned, and the limitations that you've put in place. With those limitations, is there a specific capacity restriction with those, or as far as a number of people, or is it just the spacing? Because I know some districts are, saying that they are going to play sports, but without fans. And then I have another question after this.
Okay, so I'll let Dr. Randolph answer that one.
So we've decided that, yes, there is the capacity requirement of 50% plus the 12 feet separation and the wearing of a mask. We feel that this will allow an appropriate number of people together, but yet be separated. The whole goal here is to achieve two things, really. One is to limit the projection of respiratory fluids that could contain the virus, and also try to decrease the concentration of the virus in the atmosphere. So you do that by limiting the number of people and separating them. And we believe that 50% reduction in capacity, 12 feet separation will achieve that with mask. You still must wear your mask or your facial covering. And your second question?
Thank you, Dr. Randolph. My other question is about limited service restaurants. In Nashville, the mayor allowed limited service restaurants this week, I believe, to reopen with capacity restrictions of 25 people inside at a time. Is that something that you all are exploring here? Have there been any talks with the limited service restaurants that were forced to close about some type of way that they could reopen if certain measures are taken? Thank you.
Well, currently, due to litigation issues, really cannot comment in depth on limited service restaurants. I would simply say that as we look at our data, we will let it drive us in terms of what steps we should take as it relates to restoring some normalcy.
Jane Roberts, Daily Memphian.
I wonder if you could just give us a little color on where we may be to the reopening based on how the case numbers are going down in the positivity rate and some of the other benchmarks that we've looked at.
Well, we're committed to looking at data over 2 weeks period of time, and we want to see the trend. And you may ask, well, why 2 weeks or why 14 days? That's because the incubation period of the virus is about 14 days. And so that gives us time to determine to what degree of transmission and subsequent infection may have occurred. So we're looking at the data. It's looking good. But what we don't want to do is to get so excited that we return back to where we were too soon. We want to sort of keep this progress going to the point where we are assured that this is a steady progress, and that the numbers that we're seeing are indeed consistent and persistent, and that it's not just something that will return or be escalated if we return back to normal behavior. So we're looking at it. We definitely will be making changes accordingly, but I wouldn't want to say at this moment exactly what the changes will be or to what extent.
Jane, did you have a follow-up? Greg Akers, Memphis Business Journal.
Hi, what are the protocols that are given to schools for how they track an ID who may have been exposed? Is that people within 6 feet for more than 15 minutes, or what are those things?
The guidance that recently released from the Tennessee Department of Health actually calls for 6 feet, so exposure occurring within 6 feet for 10 minutes or more.
My follow-up, since there, in light of the question earlier, since there is varying levels of understanding the information that's out there, what the protocols are for the schools in reporting and contact tracing, since it's up to the schools to disclose to their communities, if there has been any positive cases, why doesn't the health department take a more firm stance in how it monitors and reports on schools so that parents have more complete information about how to make decisions?
I'll let Dr. Haushalter address that.
Thank you for the question. Just for a few other updates that are related to your question, and then I'll answer your question. The Tennessee Department of Health is actually revising all of its guidance and tools so that schools will have the most current information. An example is there was a new document that came out earlier this week that clarifies those who need to be isolated or quarantined and what that length of time is. They're also, they being the state health department, are working on flow charts or algorithms, as we would call them in public health, that help the schools identify and then take appropriate action based on an exposure. But ultimately, the role of public health, we have sort of priorities within our role of protecting the health of the public. First and foremost, when there's a case, our responsibility is to identify that case and get that case isolated. And that's done through testing, early reporting, and then the case investigation. The second piece and second priority is identifying all the close contacts who may be at risk of becoming ill and getting them quarantined. The outer layer is more the general public who may want information. And we have to balance protecting the privacy, particularly in this case of children, with getting information that's of interest to the public at large. So we will continue to focus on our highest priorities, which is again cases and contacts, getting that information to the individuals who are at risk and in need of that information. And then as needed, if there was a public threat, we would then make more public announcements. So I do believe we've taken a stand there that we will follow what we are typically following in public health in regards to the well-being of children in schools, and then we will continue to look to the state for guidance. And as the guidance evolves, we'll change our practices as appropriate at the local level.
Those are all of our questions. Are there any closing messages?
Just want to, again, thank the community. This is, we all know, been taxing on everyone. We are moving in the right direction, so I encourage people to stay the course so that we can continue to see positive outcomes. And most importantly, we want to reduce community transmission so children can safely go to school and then in the future look towards reducing restrictions elsewhere. Thank you.
Thanks, everyone. We'll see you next week.